So glaucoma is a disease of the eye, of the optic nerve, where there is a progressive damage to the optic nerve, usually because of an increased intraocular pressure or eye pressure. So the different types are open angle glaucoma and narrow angle glaucoma. And in open angle glaucoma, obviously there is an angle in the eye from which the fluid in the eye drains. And this, if this angle is open, then it's open angle glaucoma, or otherwise narrow angle glaucoma. Also, depending on the age, we can type it into a juvenile glaucoma or adult glaucoma. So stages of glaucoma are basically depend on how much damage of the optic nerve is there. So it is either early, mild, moderate, or severe or advanced glaucoma. So glaucoma is a primary eye disease. It usually occurs because of age, that is age-related disease, or sometimes it can happen because of other eye diseases when we call it a secondary glaucoma, like if you have a cataract which has matured and you haven't got it treated, or there is some inflammation in the eye. So these things can also cause a secondary rise in pressure in the eye, which leads to glaucoma. But it's basically a primary disease in which the eye intraocular pressure is high and there is a progressive slow damage to the optic nerve which happens over time. Mostly glaucoma in the earlier stages, mild or moderate stages, it is asymptomatic. That makes it more dangerous. So it is called a sneak thief of sight because the patient would not know that something is happening in the eye. In the advanced stages, sometimes the patients, they do notice a diminution of vision, decreased vision, or pain in the eye, or sometimes if they are aware enough, they can notice a decrease in the peripheral field of vision. So these things happen at a later stage. In the initial stages, it's mostly asymptomatic. So there are three major things which are available for treating glaucoma. First are the eye drops or the intraocular drugs which we give, topical eye drops to lower the intraocular pressure. Then we have some laser therapies which are used to open the narrow angle, mostly used in the narrow angle glaucomas. And then we have surgery, which is usually nowadays used only in very advanced or severe cases when the eye drops are not able to properly control the intraocular pressure. Right, like we just discussed that glaucoma is mostly asymptomatic and the patients do not really notice any changes in their eyes. So it is very important for people over 40 years of age to go for regular screening to look for glaucoma, especially if they have a family history of glaucoma, or if they have some other diseases like hypertension or diabetes, which increases the risk of glaucoma. And if they have high myopia, again the risk of glaucoma increases. So all these people should have more frequent checkups, but even general population should have a yearly checkup to look for glaucoma because it is asymptomatic, and the earlier we diagnose it, the better it is for the patients because it is irreversible also. So whatever damage has been done to the optic nerve, it cannot be reversed. So we have to, whenever we diagnose it, we have to just stop the progression. That is our aim. And it is also very important that if you are diagnosed with glaucoma, that you go for regular follow-ups because it is very important to keep your intraocular pressure at an optimum level so that there is no further damage to the optic nerve. So it's usually lifelong treatment with eye drops which have to be put every day without fail and regular follow-ups, very important. Yes, of course, there are some side effects. There are side effects of every drug. Similarly, the anti-glaucoma eye drops also have some side effects. Mainly, they cause hyperemia or redness of the eye and dryness in the eye, and they also cause some ocular allergies, topical allergies. So we have to adjust the eye drops. We have different type of eye drops available for glaucoma. So that is why it is also important the follow-up, because we keep checking if the patient is getting any allergies to one drop, then we can switch it to the other drops and keep on optimizing the treatment as required by the patient.